Let's now begin. So, a refreshing morning to everyone. Welcome to today's webinar titled Bridging the Communication Gap Between Nurses and Lab Administrators. This event is proudly organized by Lab2Doctors. And if this is your first time of hearing about Lab2Doctors, let's just give you a brief introduction about Lab2Doctors. Lab2Doctors is committed to strengthening healthcare practices by ensuring accuracy, safety, and effective communication across, laboratory teams. Today's session is designed to raise awareness, on nurses' best practices in lab testing procedures, helping them, speak about the challenges that they face and help to aid and foster collaboration with laboratory professionals. And now it's time to, the role of the nurses is very indispensable in laboratory use, and nurses are not just caregivers, but they are the first guardians of lab accuracy. They help ensure that patients are properly prepared, samples are collected adequately, and without them, compassion and professionalism, the bridge between patient care and laboratory science would not be able to stand. So over the next hour, we will explore strategies, we'll hear from nurses, we'll listen to challenges, and understand how a communication gap between nurses and lab administrators can be bridged. So we are delighted to have nurses in our midst. Thank you so much for joining. We have nurse practitioners, we have educators, we have students, we have health professionals joining us from all fields. We're so delighted that you're able to join us here today. So let's get started into it. Thank you so much, Dr. Chessie, for joining us today. How are you doing today?
I'm doing good, and you?
I'm great. So Dr. Chessie, she's a founder of Lab2Doctors. She's a CLIA certified lab director and clinical trial study coordinator, and the chief vision officer of Lab2Doctors. Dr. Chessie has worked across high pressure environments from hospital labs, clinical trials, developing and directing QA, QC method validation and regulatory processes. And she's really passionate about keeping away lab errors and protecting patient safety. Thank you so much, Dr. Chessie, for joining us today.
Pleasure is mine. Thank you.
Of course, we have other speakers and panelists that will be joining the session. We have Yvette Lindley, we have Dr. Vivian Sona, we have a lot of beautiful people join us today, and we cannot wait to have them. So, Dr. Chessie, let's head straight into it. So give us, what exactly would you say is the biggest challenges that nurses face, or from your lab administration perspective now, what do you think can be the biggest challenge that nurses can face in the process of sample collection, and how exactly can lab adequately support them?
Well, from my experience, I would say that because the nurses or the clinicians or the practitioners who take care of patients, because they do not have total control over their patients,
Mm,
they are unable to properly prepare the patients in advance of samples to be collected for testing.
mm,
So that is some aspect of the total testing process that I think they do not have control of,
okay.
and they are unaware of ways that they could get back this control and be able to direct and assist their patients in ensuring the accuracy of their results.
Mm. That's amazing. Okay, so just before we continue, I would like to add that this is a conversation, and this requires everyone to, comment, say your thoughts, say your questions or your opinions. If in the middle of the conversation you have questions, you have thoughts, you have comments, you can always share them in the chat box. And we have our lab administrator here to talk about it. We also have qualified nurse practitioners and nurses that are our panelists that are going to talk about it. So, Dr. Chessie, thank you so much for that. So, what do you think is a way that nurses and lab administrators can communicate effectively and foster, adequacy of of these results and, of patients, of helping patients, really?
So firstly, considering the fact that the lab results are not the only things, it's not the only thing that is considered
Yeah.
in proper diagnosis and treatment.
Yeah.
It's important that the nurses know exactly what we do in the lab,
Mm,
the tools we have for them to make it easier for them, and the information that is in the lab that they do not see,
mm,
just to let them know how they can get it, who they can call,
okay.
and who to talk to in the lab to be able to get access to that information in advance of even getting the patients to
Yeah.
go and provide samples for testing.
Okay. So what would you say is the part of sample collection that is more prone to errors from your perspective as a lab administrator?
So the aspect of sample collection is patient preparation. If the
Okay.
patient is not properly prepared,
Yeah.
then that's where the errors start entering the lab results.
Mm,
Because that's the only aspect of the total testing process that has not been automated, that we do not have control of in the lab.
yeah.
All we have control of is the sample that we receive.
Mm,
Garbage in, garbage out. If you give the lab the wrong sample, we give you the wrong results. So
mm,
it's more about preparing the patient. You may want to say that patients need to hear this, but I also want to say that the nurses, the practitioners who order this test equally need to hear it because they can be advocates for their patients.
mm. That's beautiful. So would you say that there are steps to follow for nurses or that nurses can follow in patient preparation? Like perhaps are there any outline steps to lists that are designated that nurses can follow?
Yeah, for I would say for nurses to be in control of this process,
Yeah.
the first thing is being able to find out from the patients other medications that they take that were not even prescribed by them,
Okay.
medications that were prescribed by them,
Okay.
over the counter, supplements,
Okay.
the diet, their
Okay.
lifestyle activities like smoking
Yeah.
or just taking a lot of alcohol
Mm,
or very active people who run a lot.
okay.
Um, yeah, so a lot of these things are some of the things that we do not have control of, but that if the nurses speak with the patients, they'll be able to tell them you need to put this on hold for maybe 3 days, maybe 2 days, to enable to ensure that we receive the right results.
Okay.
And not only this, I think it's also important for the nurses to know the right sample to collect.
Yes.
I'll give you an example. There are a lot of women after menopause or due to some reason they are on synthetic hormone therapy. Many people do not know that the that hormones are tested better in saliva.
Hmm.
But you find many clinicians ordering blood work for hormone testing, which is not right. And then at
Hmm.
the end of the day, you do not get the right results because the concentration of hormones in blood is far less than what is in saliva.
Hmm.
So I think it's also important for the nurses or whoever is ordering this test to reach out to the lab and ask this information. If you really want to put your patients on therapy,
Yeah.
find out the right sample to be collected. Not only the patient preparation, what is the right sample? Because a lot of patients, women are on who are suffering from infertility and going through fertility treatment. The clinicians are ordering blood samples. But then the
Hmm.
truth is that the best sample to collect and monitor these patients is saliva and not blood. So these are
Hmm.
some things that that the practitioners are not aware that is important for them to know.
Okay. Thank you, Dr. Chelsea. Now I'm going to come back to you for the response, but I would like to welcome Miss Yvette Lindley to our midst. She is a psychiatric nurse practitioner at Value-Wise Behavioral Healthcare with extensive experience in mental health, nursing, and behavioral health. She brings a strong background in patient care, psychiatric assessment, and treatment planning. And she has, a lot of experience with clinical training across multiple healthcare sectors. How are you doing, Miss Livet? Thank you so much for joining us. How are you doing today?
Oh, thank you. Is it Ole? How you
Olayemi.
Olani?
Olayemi,
Okay.
yeah.
All right. Thank you so much for that was a really great introduction.
You look amazing.
Yeah.
Thank you so much for joining us today.
Thank
Just
you.
before you joined, Dr. Chelsea was talking about, the processes that are involved in patient care, preparation of patients before their sample is collected. Now, I know that not all nurses are phlebotomists that draw blood, of course, but from your perspective, what would you say is the biggest challenge that nurses face in the process of perhaps sample collection or even before their samples are collected? Now, you're a psychiatric nurse, so what would you say is the biggest challenge that nurses face in the lab, and how
Well,
can they support them? Yeah.
I'll say being a nurse for more than 14 years
Well,
before becoming a nurse practitioner. Sometimes the challenges that we used to have is like, we are not being instructed on how to collect those labs sometimes. And after collect the labs, then you see the phlebotomy, they'll be calling, they'll be like, hey, especially when you have to collect labs, some of the labs have to be like preserved specially. Some
okay.
might be they want you to like reserve them in like, ice before, sending them to the lab. But
Yeah.
sometimes we won't have that instructions
Hmm.
on how to preserve the labs before you can send it to the send it to the laboratory. So those are some of the challenges sometimes we do have. So
Hmm.
we did not know, we're not being instructed on that,
Yeah.
with the instructions. So I think that was one of the challenges, and also on how, the providers should able to educate the patients on how, if they have to come, some of the labs need to them for them to be have fasting, not
Okay.
eat for like 12 hours
Yeah.
due to some of the medication that they are taking.
Yeah.
And they will not give them that instruction. You see, they'll come in, hey, have you been fasting? No, nobody told me. So those are some of the challenges that sometimes we do have.
Okay.
When, in the days when I used to collect blood and stuff. So yeah,
Hmm.
so that's why I'm so happy that we're doing this. So we should be able to instruct, when we putting out lab orders, we
Yeah.
should have some instructions on the orders to tell how it should be collected, or instruct your patients. Hey, before
Okay.
you go in there, make sure that you're fasting before
Hmm.
going to get those labs. So those are the things that sometimes we do miss, and sometimes we get some wrong like some crazy lab results,
Instructions.
because
Okay.
they're not being followed the instruction that they're supposed to.
Wow, that's a lot.
Yes.
Dr. Chelsea, I would like you to respond to that. But before you do, let's make welcome Miss Kina Atekwane. She's a psychiatric mental health nurse practitioner with advanced training from Walden University. She brings her expertise in patient-centered mental health care and bilingual communication. Thank you so much, Miss Kina, for joining us. How are you doing today? We can't hear you. You're muted. Your microphone is muted.
Oh, thank you. It's my pleasure to join the team.
Okay. Thank you for being here today. So, Dr. Chelsea, I would like you to add to what Ms. Yvette has said. Now, from your lab administration's perspective, how do you think this can be better? Would you say that there's a way that the lab can give adequate instructions, or would you say that there's a training that can be given to nurses or nurse practitioners that can assist them with the, right tools? What would you say to that?
I'm just one of many lab directors.
Okay.
and I direct one of so many labs. To be able to say that I have a formula that would meet the needs of every nurse practitioner, caregiver out there, I don't know that. But what I know is that on the Lab2Doctors platform that you would be hearing a lot about today, you have the opportunity to reach out to many lab directors on that platform, even when it's not the lab you're using, and ask questions and have them answered. Troubleshoot results and ask about the sample type, just about anything you need to know about the lab. Reach out to Lab2Doctors.
Mm. Okay,
Thank you.
thank you. Okay, thank you, Dr. Chessy. So now I would like Ms. Kaina to add to what has been said. You know, we're speaking about the challenges that nurses and nurse practitioners face, and considering the fact that you're a psychiatric mental health nurse practitioner, what would you say has been like a challenge for you so far working with labs?
My challenges are obtaining those therapeutic level of labs.
Okay.
Basically, like we have lithium, Depakote levels, all those labs that we really need therapeutic level, and that will really determine the treatment.
Okay.
But most of the 99% of the time, there is some miscommunication or some barrier about those collections. And we end up really don't know exactly if we are getting into toxicity or we are not really, or we are below therapeutic level. Why? Because this lab that we still need those communication for the blood draw, like we said, and it depends on the provider directions to when to draw those levels. But at the same time, it depends on the acuity in those units to maintain those recommended orders that we give them to draw the levels. At the same time, it can still be a break of communication from the nurses to the phlebotomists.
Okay.
So somewhere along that line, that communication is really difficult to carry through. So at the end of the day, when you find yourself before, like you're in the middle of prescribing, looking at order, you want to check back to see when was that, or look at the time when it was actually drawn, and you see that most of the time it's not even accurately drawn. Time, because we might say 12 hours, but it depends on the facility or the hospital time that the phlebotomist will show up.
Okay. So would you say that time constraints is the most common misunderstanding between nurses and lab administrators?
Yes.
Okay, so you say time constraints is your problem. Okay, so what about Miss Yvette? What would you say is the most common misunderstanding between nurses and lab administrators?
Like as Elliot said, I felt I also add to what Kina just said. The time and the instructions,
Okay.
and they, like she said, there are some medication that we give to patients that require us to make sure we have this lab.
Yeah.
So because we have to do like the trough and the peak, so the time that we might want them to make sure this lab is being done sometimes is not done correctly. Like you can, like Kina just said, I have a patient that is on like Depakote or lithium. You be like, hey, make sure you don't take the medication before you go get this lab. But still, they will take it because they said they went there and nobody instructed them on what to do. Even though after some of the times I will instruct them, I'll be like, hey, make sure don't take your medication for 12 hours before you go get this lab done.
Okay.
And then when they go over there, the time that they were supposed to get the lab drawn is not being drawn correctly at that time. And then the lab results sometimes come out wrongly.
Okay. Okay, so I see that Dr. Jessie has her hand up. So do you want to add something to what she's saying?
Yes, I'm out of curiosity, not wanting to know the labs they are using. Have they tried reaching out to the lab director to express their concern? Because as a lab director, if you reach out to my lab and say this has been happening over and over, I would get a huddle with the team to make sure that we meet the needs of my clients. So have you reached out to the lab? Because sometimes I think, from my experience during residency, I realized that a lot of people do not reach out to the lab to communicate. But then we only know that there are issues when the patient walks into the lab very angry about lab results. And you're talking about a sick person in the lab. Like, what? I'm wondering why the clinician wasn't able to reach out to the lab. And more so, when you call the lab, say, I need to talk with the lab director. Yeah, I see. Yeah, I think Kina wants to say something.
And I also
So,
see Susan hand is up too.
Oh
um,
yeah. Let's have
our
this one.
our our expectation is we put the lab in with the recommendations and the instructions to be followed.
Okay.
At one point, the communication lies between, I can say, probably facility protocol, what time labs come in, which sometimes is challenging, or what time the patient lastly took the medication per facility protocol. We know we have a lot of stuff like that.
Okay.
Probably a facility protocol may say their 9 p.m. medication is probably 1 hour before, 1 hour after. This patient was supposed to take medication at 9 o'clock, probably took that medication 10 p.m. And looking at the time to put it together till when the phlebotomists get into the building to collect that blood draw, that is where my observation communication usually fails off a lot of the time. And probably even the nurses to communicate that. However, it is well written on your recommendation that you want this level or whole medication 24-hour proud this draws. Said if you want to find out, it's really challenging. And however, we reach the lab. If I get a result that is not, it's weird, I usually call the lab to know exactly what time the specimen was drawn. Based on the timing, for my own due diligence, I call the lab just to know what time. If I'm not too sure, I call the lab to know what time specifically the specimen was drawn. I'm able to determine where, if I have to continue prescription, because I'll be able to determine if it was drawn on time or not, if that was an accurate draw. For me, I talk about therapeutic level because this is the time that I deal a lot with therapeutic level of labs to provide me to prescribe.
I know Dr. Jessie wants to add to that, but I like Susan A to please tell us, share your thoughts and your opinion. I see you had your hands up since. So can we hear from you?
Yes, good morning, everyone.
Good morning.
I am Susan Ayuk Okata, clinical pharmacist.
Okay.
I would say, among every other thing that has been said already, that I think we all saying the same thing, but in different words. I just want to add to that with another example. I would like to say that the most important thing is we have to start off with very proper education of our nurses. And this education will come facility-wide. Wherever you work, you, the nurses, want to advocate for more education. Not one time somebody telling you, come here and tell you, please do this or do that. If it means your nurse educators to get educated, to then organize training sessions to train nurses or educate nurses on what they do on their end to impact the results or the lab results. We are talking labs here. This is the most important aspect of treatment because if a patient is wrongly diagnosed, they will not have proper treatment.
Yeah.
Point blank. That is so critical. I want to add just an example. For example, um, depending on your area of practice, where I practice, we have patients come in and they go through other departments with pre-existing lines, say it's a peripheral line or central line. And when they come to our practice and they go to a department, say imaging, they get um, contrast. They get contrast in imaging, and then they come to your area. They need blood drawn, and you don't know, or even if you knew that they came from imaging, you don't have the knowledge to say, oh, they probably had contrast, and if I draw their blood, this might affect their
The
the results
results.
of their yes of their blood work. You will just go ahead and draw the blood. So, and many other things that you as nurses are doing it ignorantly. You dare to save the lives and you want to do the best for your patients. But when you are ignorant, you are a nurse. You are not a lab technician or a lab specialist. So there are so many things that you need to know in order to give your patient the best results, the best treatment. So I'm saying this to say that this webinar, amongst other things, amongst other benefits, it should help you guys or encourage you guys to go out to your different facilities where you work, to your institutions, advocate for education to all nurses when it comes to blood collection practices. It means advocating for the institutions to seek for specialty consulting from companies like Lab2Doctors. You can go and say, listen, we have companies out there that can come and give us uh, um, broad education and training when it comes to what we have to know in order to draw blood for our patients. For us to serve our patients better, we need more than just somebody telling us here, maybe another nurse saying, this is what we do here, this is what we do there. We need a specialty lab company that can come here and give us world-class training.
Mm.
That's just my contribution so far. Thank you all so very much for
Thank you
joining.
so much, Susan. Thank you for sharing that amazing one with us. Dr. Chessie, I think you have the floor now.
Yeah, I cannot agree more to what Dr. Susan has just said. Truly, that education is needed. Even the phlebotomists do not have the education required to do what we want them to do. In my opinion, like sometimes I say they are just vampires that go around collecting that blood. They have no clue. It's just like robotics. They would get in with their eyes closed and get your blood and give it to the lab. They can close their eyes and draw your blood. So it's now, and you are the end user of whatever is in that blood. So I think it's really upon you to, like Dr. Susan said, reach out to your administration and tell them to invite companies like Lab2Doctors to come and give you the education that you need. Even the phlebotomists, they go to school for months or a year. The longest they train is for a year. Some of them do not even go to formal education. Someone trains them, they pass the certification, and they are out there drawing your blood. I don't know that it's enough to even try to tell them what they should know. You cannot tell you cannot tell a toddler 2 times 3, except that kid was just born a nerd. you cannot, where they are with the level of education, I don't think there's anything more to add to the phlebotomists. I think the onus is on the nurses to reach out to their administration, to invite companies like Lab2Doctors to provide this training that they need.
Amazing one. So the value of awareness cannot be overemphasized. Thank you so much, Dr. Susan, and thank you, Dr. Chessy. So what can you say is the first error that occurs when a patient walks into the lab? Like the first thing that can eventually lead to a misdiagnosis?
Is that for me?
Yeah, it is for you, Dr. Chessy.
Yes. So again, when it comes to lab testing, it all depends on the analyte. Sometimes they need to sit down for the blood draw. Sometimes they need to lie down for the blood draw. And it goes on and on. Sometimes just sitting down would cause a change in your protein levels, your potassium levels. So number one, it depends on what that test is. What are they coming to have drawn? How prepared are they? What is the test for? These are not things that we see in the lab. We see a requisition that just says potassium. It doesn't tell me that this patient is hypertensive or you're suspecting HIV. It doesn't tell us anything like that. So, like robots, like as automated as the lab is, we would collect that sample, do our due diligence in loading it on our automation to get results. So I think I think it all boils down to we don't have that information that the clinicians have, that the nurse practitioners have. So that is where the gap is between the lab and the doctors. All we see is we need glucose testing. And sometimes, like one of them said, we don't even know if they are fasting. And we just want to test. We are not asking if they fasted or not. Now, the person who asked that question is the phlebotomist.
Okay.
If the phlebotomist is supposed to ask that question, yet the phlebotomist doesn't even know the importance of why they need to test. Mind you, testing is not only for glucose. Depending on what you need cholesterol for, fasting is also done for cholesterol. So not just glucose. And it goes on and on. So at the end of the day, I say the requisition, which is what links the lab with the practitioners, is the gap. And that is where Lab2Doctors is. That information that I could use in maybe being proactive, even when we don't have the time in the lab, because we are trying to keep up with turnaround time. They need the results so fast to begin treatment. So where's the time even to call the clinician, right? But if somebody has to, where's the information we need to rely on to make that call and say, hey, this sample came hemolyzed. And I realized that you want potassium, is a hypertensive patient, and it's critical, or it's, whatever the situation is. Please, can someone quickly draw this, or can we get an alternate sample? Just something of that nature, So I think that there's actually a gap when it comes to this communication. Like I said, there's a requisition. All it says is the patient's name, date of birth, age, and then the test that should be tested, should be performed. And then this requisition first goes to the phlebotomist. And like I said, all they know, they can close their eyes and get into your vein. They are so good at it. They'll get that blood. And even when it says you needed to stand or sit, or you're not supposed to have done some running before this, when they ask you and you say no or yes, or they said, well, I walked a little bit, who is a phlebotomist to know if brisk walking or running or strolling makes a difference to cortisol results? Who is a phlebotomist to do that?
Okay.
So I think we put a lot of powers on the phlebotomist when the knowledge is not there.
Okay. Okay, thank you, Dr. Chessy. So, Ms. Kina, what would you say, as a nurse, you would like the lab administration to know that could assist you in delivering your services better?
Like Dr. Chessy said, that communication, that education.
Okay.
Because from what she's saying, there are so many results that I, like a provider sitting there, I might not even know that if that patient wrong, it's gonna give a wrong level. If that patient runs or on exertion, it's gonna give abnormal result. So it boils down to the fact that they need a lab doctor education. And if this is communicated and incorporated in some of our EMRs, it will help us. Or all the electronic records that we have now, or our documentation, it will really help. So those are some things that we have to start looking into. If that is communicated, it can also help the providers, give them those little guidelines, because still boil down to education, lack of education.
Lack of education, awareness, and which is what Lab2Doctors is doing. Yeah, Dr. Chessie, you wanted to answer that?
After Dr. Chessie spoke,
yeah,
I'm guilty. I will not lie, because it's not 89% of the time that I will sit down and write all like recommendations, because not probably because I don't want to, but probably because I don't know. Not that I cannot educate myself to know, but how much can you know for all labs if you've not given that education?
Sure.
Yeah, so we still need more on that, those levels, that education, and put it in our
like rules that can be shared, I
that
understand.
can be shared.
Yeah.
And when we are putting in those orders, if the requisition slips have explanation, if you are doing a lipid profile, or like she said, remember, it's a fasting lipid profile. So let it be there. If you're doing it for hypertension, cholesterol level, whatever you want to find, if they can analyze it on those requisitions, I think it will be easy for us to go, because it's
Okay.
women.
Dr. Chessie, I will know you want to, say something to that, but I would love for us to hear from Miss Yvette. What would you add to this?
I'm telling you, knowing Dr. Chessie, I've learned a lot, because she's very passionate on what she does. And I remember she always asks me, "Hey, Yvette, you guys do other labs, and do you really guys know exactly how it's being done in the lab?" I'm like, "No, all we look is to see we look just for the result, to see if it is in a therapeutic level, if we are looking at the result, if it's okay, or or it is, it's not. It's just on how we adjust the medication, on how the blood work is being, we see through the result, So it actually it helped me. Sometimes I go down to the nurses and just to watch them, how the blood is being collected, just from me talking to her all the time. And I actually did that last week. I just went to, I have a patient that came in to collect blood, and I'm like, okay, let me just go in there, even though I know I've been doing it when I was, as a psych nurse practitioner. We really don't have an hands-on drawing blood.
Okay.
So I just went down there just to watch and see. I was trying to see if they're asking the proper question for these patients, like, "Hey, before you come on, did you do your fasting like the provider told you?" And I was very impressed to see that, at least, to learn that at least they kind of really educating the patient, or they're talking to the patient on, if the blood that to talking to the patient on, hey, on their, like, before they collect the blood from the patient, they ask them those questions, which I was very impressed about it. So which means that the education or whatever I put on my, before I send in my lab work, put the instruction and they follow it. So knowing Dr. Chase, I've learned a lot on that. Like I kind of follow up with that last week, it was very impressive. So really we only just look into the result. We don't really know how it's being processed in the lab. So which is something that I was really interested and I learned a lot.
Okay, thank you, Ms. Liebert. So Dr. Chester, you have the floor.
Yeah, I wanted to take this opportunity to, I had some 4 slides. This wasn't intended for PowerPoint presentation, but some people are visual learners. So I decided that I was going to, at this point, bring up these slides and just show you guys something related to the lab. So let's see, right here. Do you see my slides?
Yes, we do.
All right, so let's see, I want to close this window here. All right, so this is an example of what happens. So you have a patient in the big green window to your left that either jogs, runs, there's intense exercise, there's prescription medication, over-the-counter, recreational drugs, herbs, spices in the kitchen, alcohol, fruits. All of this and so much more are in your patient. And then on the other hand, you have a test method that any of these things, when it meets the test method, could go wrong and cause wrong results. You also have an instrument type. The instruments are different. As nurse practitioners, you are not even aware that there are the same tests that can be done with an immunoassay can be done with a mass spectrometer, and that mass spectrometers are more accurate. So when you, let's say, for example, with no bias, I'm just calling LabCorp because we all know about LabCorp. If you choose LabCorp over Quest Diagnostics, what is the reason for choosing LabCorp? Are you aware of these details? Is this something that you're interested in knowing? This is the kind of education we can give you if you invite us into your companies. The other thing I want to show you is to tell you that all tests are not created equal. So the green line you see is the RNA from an HIV virus, okay? And you have 3 companies all in the black windows that you see there. The first company called Manufacturer A uses these 2 regions, the 2 arrows that you see in front of Manufacturer A. I hope you see my cursor. This company manufactures an HIV assay using these 2 arrows, these 2 regions of the RNA from the HIV virus. Then you have company B that decides to make their own assay, and they use this region, one from manufacturer A and another one. And then you have company C that uses only one region, but the same region that is shared with manufacturer B. You see how different these assays can be? The interesting thing is that you see the region that manufacturer C uses. For patients who are on Coumadin, if you take Coumadin before this test, it's going to cause falsely negative HIV results. But as a nurse practitioner, are you aware of this? That knowing what your test can do, knowing the limitations of your test can help you be better at what you do. Do you also know that in the lab we have package inserts to every test, and every test has a limitation? This is an example of a package insert, a real package insert, but this package insert is for cholesterol. For privacy reasons, I've kept away the name of the manufacturer. But look at the limitations of this cholesterol test from one manufacturer. It says that N-acetyl L-cysteine at therapeutically achieved concentrations may lead to falsely low results. For those of us in the US, I know people have joined us from everywhere. For those of us in the US, N-acetyl cysteine is either prescription or over-the-counter. When it's over-the-counter, you have no control over what your patient is taking. When it's prescription, maybe. How about a patient who has multiple doctors? So it's a different doctor who prescribed it, so you don't even know what the patient is taking. How do you handle this when you are not aware of it? This is information in the lab. And that's why I think that the lab education is important. Last but not the least, for this set of slides, I spoke to a lot of clinicians, nurse practitioners. who are my friends and asking them, where do you go to when you have these questions? Some of them said up to date, Google, YouTube, Micromedics drug interactions, drugs.com. Some of them said they were still looking, like they don't get what they are looking for, and so they are still looking. And that's how Lab2Doctors came into existence, because we have gone and looked at all the resources out there. What we have, none of them have it. So that is exactly what I wanted to show you, so that it brings you a closure to what we do in the lab. There's so much, we cannot use one eye and say everything, but I hope that you've understood in a way what I have to tell you.
Thank you for sharing, Dr. Chessie. And I just, want us to talk a little bit about that. I know we don't have so much time. So now, Miss Yvette, what would you say you consider when selecting a lab? Based on the slides that were just shown to us, do you consider tools? Do you consider certifications, or you select a lab based on referrals? Okay, if you can hear, you're muted. Your mic is muted.
Okay.
It's muted again. It's muted again. We can't hear you.
Just so you know, Dr. Vivi is here, okay?
Yeah.
Dr. Vivi, please get on
Okay, Dr.
camera.
Vivian Sona. Hi, welcome. Thank you for joining us. Can we have you? Can we see you?
He just got out of the gym.
Okay, that's fine. Thank you
I
so
can
much,
turn
Dr.
on my
Vivian.
camera for briefly, so at least you can see my face, but I'm in gym clothes.
Okay, Dr. Vivian Sona is a certified family and psychiatric nurse practitioner, and she's been doing amazing with compassionate psychiatric services in Texas. Thank you for joining us, Dr. Vivian, today. Thank you for joining us. Okay. So we were speaking about how nurses the tool, if there are certain regulations that nurses use to make lab referrals, and Miss Yvette, so you're about to answer that.
Yeah, I said I basically I do labs based on my patients on the medication that my patients are on.
Okay.
So that's how I base on doing labs on on making sure that the medications is not affecting their their system, is not affecting their liver, their kidney, and then make sure that there's no toxicity going on. And then, basically that's how I kind of obtain my labs from the medication that I give to my patients.
Okay. Thank you for sharing
Alayemi,
that.
let me
Okay.
help with this question, please.
Okay.
So just so you know, they work under companies that choose the labs that serve that company. Okay. So Dr. Yvette doesn't have the powers to say, I need LabCorp, I need Quest Diagnostics. What the company offers them is what they use, except she's a private provider on her own. Otherwise, I think this question is a little bit more for the CEO or who makes that decision for the company.
Okay. All right then. Dr. Sona, thank you so much for joining us. And we've had, quite an interesting conversation about lab practitioners and lab administrators. From your perspective as a family nurse, what would you say can assist your work or assist you in delivering your service better that the lab administration can do?
For me, the main thing is getting a lab that is accurate, because even though I worked as a family nurse practitioner, I worked in addiction where we prescribed Suboxone, and we do labs and then confirm the labs. Then we do urine drug screens, which need to be confirmed to show that the patient is metabolizing the medication. So getting an accurate results is really important. And of course, addiction world is a lot of fake urine going in as urine to get accurate results, like checking for creatine and all of that. The main thing with me is to get an accurate lab result without any false positives and false negatives.
Okay. Okay. Thank you so much for sharing that, Dr. Vivian. So, as a nurse practitioner, who do you turn to when your patient is not, taking their drug or their medications? Because we've had occasions whereby a patient comes in, they get drugs, they get prescribed, they take their samples, are collected, their results are analyzed, and then, the drugs are prescribed to them, but they eventually don't take it. Now, who do you turn to in this situation like this?
Depends on policy from where I stand from. If I prescribe like a controlled substance to a patient and I test you, you do not have the drug in your system. First things first, I will not prescribe to you again until I get a positive. So that is the first thing. First of all, you have to protect yourself because I can't prescribe a benzo and then you don't have a benzo in your system. All right, given you take it as needed. But every month I've been prescribing 30 pills and you come in the next month and tell me, oh, you need a prescription and I prescribe another 30 pills for the month. And then you take a drug test and you don't have it in your system. First things first, somebody's taking the medication and it's not you. Because if I'm prescribing it every month, we are counting pills and you've taken the pills and you perform a drug test, you're supposed to have it in your system. If I'm prescribing, say, Adderall, and I perform a drug test and you don't have it in your system, first things first, I do not prescribe until I get a positive drug test. The patients can go and steal or do whatever they want to do, but from my perspective, I will not prescribe. And then, of course, depending on where you work, my clinic, you do let the administration knows that, hey, I have not prescribed this patient's medication. I have checked for labs and patient is either not taking the medication or diverting. So I tell that to admin so they know, okay, yes, I'll prescribe every other medication that is not a controlled substance, but the controlled substance.
Okay, thank you so much for sharing that. Now, Dr. Chessie, we spoke earlier, especially Ms. Kina spoke about time constraints in this kind of, when the sample is collected and the retaining. So how can we ensure that nurses, they retain the quality of the sample, especially when they are faced with more patients and less hands? From your perspective as a lab administrator, how would you say the nurses can, retain the quality of the sample collected?
I think not until that education is brought into their system by their administrators, because they have the powers to bring that education in. The education will not only be at the level of the nurses, it's going to be at the level of everyone who has a role in ensuring that the sample is collected timely enough and tested as expected by the practitioner. So again, I think not being in every facility, again, they just need to bring Lab2Doctors into their companies to speak with the different teams that are responsible, that would have to touch that sample at any point in time before it's tested.
Okay, so we've spoken about awareness, we've spoken about education and training. Let's dive a little bit into technology. Now, what role can technology play in improving communication between nurses, nurse practitioners, and laboratories?
That we have an AI solution that is coming up to be able to tell you this, and that together with the education that your departments need, you're going to have this in your hands to troubleshoot these results yourself. You have your patient, you talk to them, enter the information, and see what it tells you. This is being built by lab professionals. We are putting this together because, again, we realize that there's that gap that nobody is talking about.
Yeah. Thank you so much for
So
sharing,
looking
Dr.
at this,
Chessie.
looking at this, I'm interested in knowing Just drop your information in the chat window if you would like to be one of the beta testers when this goes live, because we are currently working on it. It may be a lifesaver for you, removing some of the frustrations you have with lab results.
Okay, so if you're interested in being a beta tester for the AI technology from Lab2Doctors, you can drop your emails or send a direct message or visit the website Lab2Doctors. Dr. Chessie, that was really, really innovative. Would you say this is quite sustainable? How sustainable would you say this is?
I would say that considering that this is what we do when these questions are asked, there's nothing as, you have a patient in front of you, you have 15 minutes or 30 minutes, and you're seeing results that are inconsistent. Who do you turn to? Are you going to browse the entire internet? Not even ChatGPT will tell you everything. Where's the time to read it? As opposed to just clicking twice, entering the information and clicking twice to get all of that data in one place. It's customized to your patient. You're not reading something random, you're reading about your patient. So I think nothing beats this when it comes to closing that knowledge gap.
Okay.
And empowering the nurse practitioners to do what they enjoy doing.
Okay, so as we've come to the end of our session, but just before we leave, I'd like everyone to share their thoughts. What practical steps can be taken to ensure that, proper communication flows between nurses and laboratory administrators or personnel? From a lab perspective, I would love a response, and also from the perspective of the nurse practitioners. What practical steps do you think would assist you as a nurse, and what practical steps do you think will assist the lab to also ensure that communication gap is bridged? Do you want to go first, Dr. Chelsea? Okay. Okay,
I would
let's
say
have
education. I think educating the nurses on how educate them on how to collect the labs is very important. They should be able to be educated on that. Yeah.